Would you believe it? Over 8,000 Americans were recorded as having died of COVID last week. There are now more people in American hospitals suffering from the disease than there were when the pandemic first peaked in the spring. Now, the upper Midwest is the area of the greatest concern because the rate of cases is increasing the fastest there. And amongst those states is South Dakota, very sparsely populated, not much bigger than Leeds, and yet it's had over 800 deaths, with almost half of them this month alone. It has one of the highest mortality rates anywhere in the world. I've just come back from South Dakota, and here's my report. COVID-19 has swept across the immense plains of South Dakota, ushering in one of the highest death and infection rates anywhere in the United States. Ravaged by the droughts and dust storms of the 1930s, this has always been home to frontier folk who've sought protection in their own isolation, only to find it wanting once again. And just a mile from the original little house on the prairie, the modest homestead of the Bjorkman family, as it turned out, more dangerously exposed than they knew. Christine Bjorkman telling me her sick husband had to be flown for treatment out of state because the main hospital here was full.
Oh my gosh, yeah, every room was full. Every room was full, but also I seen where people were taken out in black bags. 2 people. I seen 2 people go out in a black bag before my husband did.
We just moved.
Her husband, John, was a retired school administrator and just 66. A lover of the great outdoors, a man who wrestled with his grandchildren. So when they both fell ill, she'd assumed he would be the one to survive it.
Are you embarrassed on behalf of South Dakota that you've got these terrible statistics as one of the worst states in the country?
Yes.
So what's your message to the governor of the state?
Step up and help us. Help us so that we're not losing our loved ones, that we're not making our neighbors and our family members sick.
It was at Mount Rushmore in South Dakota where Donald Trump celebrated American independence. This tightly packed event at risk of spreading the disease further. The president's host was Kristi Noem, one of his favourite governors, one of just 9 out of 50 who've refused to make face masks compulsory.
Some have said that my refusal to mandate masks is the reason why our cases are rising here in the state of South Dakota, and that is not true. Others have said that my refusal to advance harsh restrictions like lockdowns is another one of the reasons why our cases are rising, and that is also not true.
Sioux Falls is the commercial capital, its main street still with more than a whiff of the Wild West about it. Restaurants and bars remain open. There's no order for churches to shut, in a state with the fewest restrictions and the highest hospitalisation rate anywhere in America. The calamity which is unfolding here is not just about large numbers of people falling sick and dying. It's also about a clash between scientific advice and a very precious notion of freedom here in the American Midwest, in a state which voted heavily for Donald Trump. You can hear that clash amongst the shopping trolleys of South Dakotans, stocking up before this week's Thanksgiving holiday.
This is a Republican state. They don't want their rights taken away. They want to have that freedom and to do whatever they want. So, I mean, it just kind of comes with the territory, I guess.
The price you pay.
Yeah.
Do you think the governor should insist that people wear masks?
No, not at all. I'm 100% for our governor. I think she does an awesome job.
Why do you like her?
She lets the people be the people.
I work in healthcare and we are overrun. There are no hospital beds. Too many people have died, and people are dying every day.
So why do you think the governor hasn't taken more action?
I believe because she's following President Trump, and I am a supporter of the president as well. I just don't agree with her on how the pandemic is being handled. It seems like more of a popularity contest to me.
And they don't want to believe that COVID is real.
Last week, this South Dakota nurse, Jody Daring, made headlines when she talked of her patients screaming at her for a magic medicine and refusing to believe that the virus made them ill. That opened the door to others daring to describe the scale of this pandemic and to question the response, including Jody's friend, Nurse Heidi Mayer, speaking for the first time.
I can tell people how serious it is. I'm there. People in the White House aren't in Sioux Falls, South Dakota, in my hospital seeing my patients right now. I am. And they're sick. They're sick. And they're scared. That's the number one thing I feel, is that our patients are so scared. They ask us, am I going to die today?
What do you say?
Not today. I just say not today.
Over 60% of South Dakotans voted for Donald Trump this month, a president who suggested taking disinfectant for the disease. And Nurse Mayer is struggling to contain her anger.
I don't know who to be angry at. Do I be angry at him? Do I be angry at the governor? Do I be angry at my friend who refuses to wear a mask? I don't know who to be angry at.
Maybe you should be angry with all of them.
Yeah, I could be. Then I wouldn't have any friends.
Beneath these vast skies, South Dakotans are victims of their own self-reliance. Rugged pioneers who will only travel across the prairies in search of medical help when they really need it. So says this doctor, just re-elected as a Republican to the state Senate, and he too refuses to say he would lock down.
The number of states that have the level of non-restriction that South Dakota has, you can count on one hand, I think, and that number is growing smaller every day.
But aren't you a bit embarrassed by that? Because you've got this skyrocketing problem and you're not doing very much about it.
Well, I wouldn't say that I'm embarrassed by it. It is a different approach. It's definitely not what you see in some of the larger communities, but I think that our governor has made a decision and a determination based on the data that she has access to, that this is the best way to lead her state. And that's where we are right now. I think
you as a doctor don't have a problem with any of that.
I would say that if I was in her chair, maybe there would be different decisions. I think you could say that of anyone.
But he doesn't believe in calling off a controversial interstate college basketball tournament involving hundreds of spectators and scheduled to begin here later this week. In a land determined to plough its own furrow, whatever anybody else thinks. Jonathan Rugman, Channel 4 News, De Smet, South Dakota.